Late, the National Drug Authority has been at the heart of operations to catch drug shop operators dealing in counterfeit products or working without license. In the latest operation, like you've just seen, NDA swung into action and closed 8 drug shops for dealing in counterfeit veterinary drugs in Chotera district. They also seized drugs worth 40 million shillings. And tonight, we turn to the NDA spokesperson, Abias Ramiri, to explain to us why we're seeing a shift in the operations from the human drug operators to those dealing in veterinary drugs. A very good evening, and thank you so much for joining us tonight.
Thank you so much, and good evening, the viewers of NTV. Why National Drug Authority is moving from human to vet? That's what our policy, the National Drug Policy and Act, gives us. It gives us the mandate to regulate both human and veterinary drugs. Now, when you look at how veterinary drugs operate, drug shops and pharmacies operate, most of malpractices, non-compliances are done under the cover. So we must rely on intelligence for us to be able to know. And that's why most of the times when we go out in our regular operations, we usually get some of the malpractices in human drug shops. So we don't sit back. We deploy our intelligence to tell us where some of the gaps are in the veterinary, because most of the practices are either done on the farm, and we've actually seen that some are being done by the professionals who should be helping farmers. So they go and counterfeit and use their channels of connections, because they know so and so is a para vet, so and so is a vet. So they go to the farm and use those channels to distribute counterfeited, rebranded products. So we have strategized our operations, especially on veterinary drugs, and that's why we are able to start coming up with all these. For example, in Karungu, out of the 36 drug outlets that we visited, you can't believe that we found some of the hardwares we are selling in veterinary drug shops, so agrochemicals, merchandise shops, so, and also illegal outlets that work in a way they don't have even a signpost. So it means they know that their clients know where they are and how to find them. And without the intelligence, it becomes very, very difficult for you to crack on such.
So do you demand the same standards for legal compliance, like say licensing for both people dealing in drugs for the humans and of course the vets as well? Do you require the same? We
require the same standards, because a drug is a drug and its sensitivity is the same. But also, in some cases, we actually demand a higher standard for veterinary drugs. For example, some of the things we found in Karungu, there were issues of poor storage, but also a very bad cold chain for vaccines. Now, when you have when you don't have proper cold chain, it means government will give people with vaccines to deal with different bee, foot and mouth disease. When it is poorly stored, it will be less effective, and that's why we are getting all these resistance from all these drugs that are handled badly, that are being repackaged, because when you repackage the drug, we fear that some of the containers we are seeing, they were dirty. Some have even human drugs in them. So what they do, they go to these health centers and pick reused bottles. I mean, they pick used up bottles, empty ones, and then they go and start repackaging. And when you listen to the excuses, is that some of their clients come looking for smaller quantities, but it risks drug-to-drug interaction, but also it creates a gap for them to start repackaging expired drugs and sell to clients as if they were, okay. So we want to warn and encourage members of the public that when you're going to buy veterinary drugs, go to a licensed drug shop. but also to give the public the confidence that our teams are on ground. We will continue doing these crackdowns, because even those that are licensed, we've seen that we give you a license. When you are qualified, then after getting the license, you hand over the operations to your wife, to your child who is in vacation, and these don't know how to prescribe and also which drug to give. And also some, they go behind us and start stocking drugs that are above the class they are supposed to be selling.
Now, once again, maybe taking you back to the aspect of licensing as we conclude our conversation, we've seen a number of operators failing to comply. Is it an issue of the entire process being expensive or complicated?
It's like any other malpractice we see. People are always going to break the law. The issues of the demands we put are really safeguards. And for anyone who wants to get into this business of selling drugs, whether human or vet, we know that they make some good money. So it is not that you can't afford. It's just that when people get in, they want to bend laws. Others know that they cannot qualify, so they will start looking for shortcuts. But as National Drug Authority, we are out there to protect both human and animal population, and we will continue to make sure that whatever drug that is allowed on the market is safe, is of good quality and efficacious, but also administered or prescribed by the qualified personnel.
Thank you so much.